You worked on a paper called Public Perceptions Toward Kratom Use in Malaysia. How do public perceptions of kratom consumers differ in like Southeast Asia in general and the West? And does this public perception lead to bad or good drug policy in general?
That's a great question. So Kratom is used in a so Kratom has been traditionally used quite frequently and is still quite frequently used in Malaysia, in Southeast Asia, um, by uh, by folks that just basically have a kratom tree in their backyard and they pick the leaves off and uh, use it either to just chew on a leaf and kind of stay awake, or
Mhm.
to increase their stamina when they are day laborers, or they buy kratom tea in little bags from a local vendor um, to self-treat pain, or primarily pain after a hard day's work. So it is used by more of a rural inhabitants, not necessarily in large cities, I would say.
Mhm.
But it is seen as a traditional drug that is tolerated
Yeah.
there, and it is not seen as a bad habit.
Mhm.
Certainly nothing like an opioid or like amphetamine, which is a large problem in Malaysia as well, and in
Mhm.
Thailand. So it's definitely distinct from that because it has such a long use history. The reason that it was banned, but is still kind of tolerated, is because it has, to my knowledge, kind of interfered with the opium business that has grown in Malaysia in the 1960s and 1970s.
Mhm.
So that kind of led to its ban, but even that is now being reconsidered. So there have been some, at least for medical uses, kratom may be made available again, or maybe used by folks in Malaysia again, and in Thailand as well. In the West, I think what was really surprising to me is to see the the average kratom user, when we look at the demographics, is not like an opioid or illicit opioid user, like a heroin user, or like an illicit drug user in general, in terms of their age range. They tend to be middle-aged, they
Mhm.
tend to be employed, they tend to be married, they tend to be uh, they tend to have a middle class income, they tend to have health insurance. These are not necessarily, this is not the profile of an illicit drug user
Yeah.
that we usually see. So it's definitely a distinction for kratom users in the United States. And it's primarily still used in the self-treatment of acute and chronic pain and mental and emotional conditions. So its use is not primarily focused on, um, as not even focused on mitigation strategy. It is used for that purpose. I'm not saying it's not, but it's not the primary use. More people are using it for acute and chronic pain, and for an emotional or a mental condition such as depression, anxiety, as I mentioned. So I see it used in a very different manner from a recreational drug in the West.